Good morning, thank you for joining us. You're presenting the findings of your research on colorectal cancer in young adults and genetically predisposed populations. This disease is usually associated with older people. So can you summarise the project and outline its importance for patients?
Indeed, colorectal cancer is most common in adults above the age of 50. However, in several countries across the world, we saw an increase in incidence of colorectal cancer in young adults. For Europe, these trends in CC incidence were unknown, and therefore we analyzed the incidence rate of colorectal cancer in young adults in Europe and found that the incidence increased by 5.9% per year for adults between the age of 20 and 39. And for adults between the age of 40 and 49, we saw an increase in incidence by 1.4% per year. I think for gastroenterologists, but also for the general public, it's important to be aware of this trend.
And how might this affect the gastroenterology community, do you think?
I think it just, as Fanny already said, it's just giving us a more awareness about this new trend. So we're used to, especially due to the colorectal cancer screening programs, to focus especially on the target of people 50 up to 70 years of age. But based also on the publications that in North America, in China, in Australia, but there was in all those countries an increase in younger adults. So that's why we were asking ourselves, what about Europe? And we found actually that also in Europe, in these young adults, especially 20 to 39, there was a significant increase in colorectal cancer. So what will it affect us in our practice is more an awareness that in case that people who have rectal blood loss, it can be that also in these patients there is a risk of colorectal cancer.
Mm-hmm. Mm-hmm. And in your abstract, you say that we're not really quite sure of the cause for this increase in sort of incidence in a younger population. Most people think it's due to lifestyle issues, but did your research throw up any other theories?
Well, the first step was to assess the incidence of colorectal cancer in young adults to know if this increasing trend was also present in Europe. Indeed, the next step will be to identify those etiologic factors. However, our results did show that that colon cancer has a more pronounced increase risk has a more increased incidence compared to rectal cancer. And from former literature, we know that lifestyle factors were more associated with colon cancer risk. So therefore, it can be hypothesized that lifestyle factors can contribute to this phenomenon, but we need to do more research to clarify this.
And is there anything else other than sort of lifestyle factors that you think might have an implication?
Yeah, we actually don't know, but I think this is the most important thing what we now have to currently to address. What is the reason that these young adults have such a high increase, or that this risk is increased over time? And you can think about lifestyle, but also processed meat. Somebody talked about the McDonald's generation. Mm-hmm. Maybe it's the use of antibiotics. So there are many reasons I think we should investigate it. Is it also the obesity, more diabetes? So I think the first start is to look at the risk factors for colon cancer and to see if there is a correlation also in these young adults.
And is that the next steps for this particular research project, do you believe?
Yes. I think we need to identify those clinical and pathological characteristics of those patients getting colorectal cancer at a young age. So that would be the next step.
And is that complicated to do? Do you think it's possible?
What we did for this part is we used cancer registries in all of Europe. So now we have to get more data, more personal data. So that's always a challenging project. But we can make a start just by looking at, for example, weight, obesity, the numbers of diabetes, and also in our own country, which makes it much easier to start with, to get more insights in these patients.
And what do you think the implications are for national screening programs of this research?
Yeah. Well, although we see this increase in incidence, and it's quite alarming, the absolute numbers are still very low. And we see that the mortality rates were not affected. Moreover, the increase in incidence is most pronounced in adults aged between 20 and 29. So we think that identifying those at risk will be more helpful than lowering the screening age in the screening programs in Europe.
And that identification process, what would be the pathway for those that you felt should be screened or seen earlier?
Yeah. Well, I think we again should identify those clinical and pathological characteristics, and then we know who's at risk and who's not.
Perfect. Thank you very much.